Hey guys, so I just wanted to go over some of the desensitization and scar tissue management. Honestly, this could apply to any scar. I actually have these little packets in the clinic for all my patients that have surgical scars. So it applies to C-section as well. But the reason that we're doing the desensitization is because they cut through your skin actually, which cuts through your cutaneous nerves, which are your skin nerves. Those nerves give us sensations like pinpricks or soft touch. So what we're trying to actually do, believe it or not, is irritate the nerve so that the nerve kind of like draws attention to this area and starts regenerating and growing in the area. So the desensitization techniques can be done almost right away. I wouldn't probably do them right on the incision site, probably the first week or two, but then after that you should be able to do it. The scar tissue management is a separate thing, so you definitely need to wait 5 to 6 weeks. And then sometimes too, it'd be a good idea just to ask your doctor if you're ready to do that. So the desensitization stuff, what you want to do is have different textures. So not all the same textures. You don't need to have a packet like this, but you literally can just have like, this is sandpaper I stole from my husband. And then this is just a softer felt. This is like really, really soft. And this is burlap. So again, you don't need to have this. You could take like the kitchen towel, which is a little bit rougher. And then you could take one of those like super soft kid blankets. And then you're just using different textures is the biggest thing. So when you are doing this, you only need to do it about 5-10 minutes. And I will tell you, like right after the C-section, it does feel kind of funny to actually do it. So what you would do is, I drew one so that it's like not super, super low. But when you're actually doing this, you take it and like rub it around the C-section scar. And then you can rub it over the C-section scar as well. And again, like you're just playing with the different textures. There's no like set amount of time each texture has to take place, but you'll see like what kind of irritates you. And again, it does feel funny at first. So just small little circles or coming like up and over. We're just trying to desensitize the nerve. So this would be super applicable for moms that have pain like with their pants lines, because honestly your pant line hits like right where your C-section scar is, usually like worse with jeans. And in the clinic I've seen where patients, moms have problems like literally when they're age 50. So if we do it now, then we just won't have any problems. So you can do that desensitization. They say up to 6 months to 2 years. I kind of slowed down a little bit, but I was pretty good with Avery about doing it. It was definitely more tender with the second C-section than it was with Brooke with the first. Although with Brooke, I did more of the scar tissue manipulation and mobilization that I'm going to show you right now. So with her, they had a tough time actually finding one of her feet. So they would like literally pull parts out like, oh, that's an arm. Oh, that's an arm. And then like tuck it back in, my husband said. And then they were looking for one of her feet because she was breached. So they could not get her foot out. So that's Brooke right now. So the right side of my C-section scar was like super, super, super sore from them pushing and manipulating her. So when you're doing the scar tissue management, and I'll set Avery down so we can show this. Hey, Bubba, you want to come up here? You want to show them how to do it? Huh? So when you're doing this one, you actually will pinch the skin sometimes and roll the skin in between your fingers. So again, you're pinching the skin and rolling that scar in between your fingers. The other thing that I like to do, and this is a little bit easier right when you have it, is hold a hand here on one side of the scar and then gently drag your other finger away. This would be best done with lotion actually on your fingers or oil. And again, you want to make sure that incision site is closed and healed before you do this. But again, I want to manipulate it in different directions. So I'm going diagonal here, I'm going across this way. And the other thing that I wrote on this post, which is super helpful, this is like the primo package if you're going to do it. But you guys might as well know the best tricks and tips. But for this, what you would do is like, so for example, my right side was really bad. So I can wind this up left, right, and like, so for example, right there, I mean, I can even feel some of my scar tissue all the way up here from way down here from my C-section. But so I'm winding that tissue up. Once you feel the restriction and movement, I can take 2 or 3 deep breaths through my diaphragm. So And then once you take those deep breaths, kind of wind up the tissue more. It is crazy because the tissue will give and go when you're using that diaphragmatic breath. So those are very, very helpful tips on how to manage these C-section scars postpartum. All right, guys.
Mommy, mommy.